Hi ladies, hope all of you had a nice week off. I'll be talking about Sturge-Weber syndrome this week, and I'll try to make it quick so you can watch the video at the end. Sturge-Weber syndrome is also called encephalotrigeminal angiomatosis and is a neurocutaneous disorder with angiomas. Angiomas is an abnormal growth produced by dilation or a new formation of blood vessels. The syndrome is a rare disorder existing at birth, and it may be characterized by a port wine stain that presents in the forehead, scalp, and around the eye. It can present as a neurological disorder and will affect the muscular and nervous system. And approximately 1,000 babies are born with port wine stain, with 6% of those babies having symptoms associated with Sturge-Weber syndrome. It is not caused by an injury, and the condition is not inherited. 1 in every 50,000 live births in the United States are affected by Sturge-Weber syndrome. And some pretty common things that can happen are seizures, and from the seizures you'll see the developmental delay and the mental retardation. They may have hemiparesis, hemianopia, headaches are pretty common, and glaucoma as well. Occurrences happen in the midbrain. There is a cerebral volume loss, and you'll see the calcification of the front parietal subcortical area and leptomeningeal enhancement of the front parietal. There is asymmetric enlargement and enhancement of the right choroid plexus, which is a network of blood vessels in each ventricle of the brain and is derived from the pia mater and produces cerebral fluid. In the bottom picture, you will see a pretty significant atrophy of frontal lobe on an 11-month-old. Demonstrating the left lateral area, and on the top, in the left occipital lobe, you will see abnormal calcifications, and then on the picture to the right, the choroid plexus is enlarged in the posterior horn of the right lateral ventricle. Blood vessels. Blood vessel formations associated with Sturge-Weber syndrome start in the fetus. In approximately 6 weeks of development, a network of nerves develop around the area that will become the baby's head. So this network usually goes away in the 9th week of development, but unfortunately in babies with Sturge-Weber syndrome, this network of nerves does not go away, and it will reduce the amount of oxygen and blood flowing to the brain, which can affect brain tissue development. So this presents with Sturge-Weber syndrome presents with abnormal blood vessels on the brain surface and the loss of nerve cells and calcifications of underlying tissue in the cerebral cortex of the brain on the same side of the brain as the birthmark. So there is a random mutation they found in the GNAQ gene. It is an activating mutation gene caused by the somatic mutation that can occur randomly through lifetime, but as of now, they do not know the cell types on the genetic mutations yet. So you'll see the characteristics of the port wine stain, and they are red-colored marks of all shades that appear most commonly on the face, however been other areas of the body as well. It happens when the area of skin doesn't get any or sufficient supply of nerve fibers, which help keep blood vessels narrow. And when there is a lack of nerve fibers, small blood vessels called capillaries keep expanding, allowing a greater amount of blood to flow into the blood vessel, causing a stain to form. And 70% can be unilateral and often ipsilateral to the intracranial angioma. So the neurological signs, you'll see the developmental delay and mental retardation. Your learning problems will happen. Attention deficit and hyperactivity disorder is present. And so the cortical damage, of course, is your seizures. You have the increased focal and diffuse atrophy, your increased calcifications, development of hemiparesis, and your deterioration in the cognitive functioning. So some of the physical signs, we talked about port wine stain already. You'll have your macrocephaly, which is your larger head circumference. You'll have the ocular manifestations, soft tissue hypertrophy. You'll have your hemiparesis, which is the weakness on one side of the body, the visual loss, the hemianopia, which is the visual field loss on the left or right side of the vertical midline, and then your homonymous hemianopsia, which is a loss of half of the field of vision on the same side in both eyes, and I have a picture of that shown to the right. And then with the ocular involvement, you'll have the glaucoma, the red color of the fundus with the glaucoma, diffuse choroidal hemiangiomas, and then superficial changes in the eyelid. There are 3 types of Sturge-Weber syndrome, type 1 being the most common. The blood vessels grow in an unusual way on the face and the brain, and type 1 can lead to seizures. The seizures usually happen before a child's first birthday and can continue throughout their life. This can delay a child's development and can cause learning disabilities and glaucoma. Glaucoma is a condition that increases pressure inside the eye. Where type 2 involves a port wine stain on the face, this type of Sturge-Weber syndrome doesn't usually affect the brain, and it can lead to glaucoma, differences in blood flow, and headaches. These symptoms can last into adulthood. With your type 3, it often involves unusual blood vessel growth on the brain, and this type has no port wine stain and usually no glaucoma. So diagnosing type 3 can be very difficult, and it is often confused with other conditions. So doctors have to use brain scans to identify and diagnose this type. So from the clinical diagnosis in an infant with port wine stain, not all, we have to remember, not all have Sturge-Weber syndrome, and not all Sturge-Weber syndrome have port wine stain. So seizures may be the first symptoms of the port wine stain in a child, usually by the first year, and then they are usually frequent and prolonged. Glaucoma is usually diagnosed, and if there is a neurological involvement, an X-ray of the skull to show classification of calcium deposits may be done. A CT scan of the skull to show calcifications, abnormal veins, and brain atrophy will be done. MRIs are shown to, they're done to show angiomas, benign tumors made of blood vessels. You may have a single photon emission computed tomography to measure blood flow in the brain, and then an EEG can be done to evaluate any type of seizures. So due to the progression nature of the Sturge-Weber syndrome, multiple MRIs are conducted through the lifespan. So the prognosis. Sturge-Weber syndrome is not life-threatening. The quality of life will depend on the severity of the symptoms and how they can be prevented or treated. And ongoing visits with the neurologist, ophthalmologist are very important to frequently follow up with. And despite all these difficulties they do have, these individuals can go on to live a normal life. So treatment for port wine stain, you'll have the laser treatment is used to lighten or remove port wine stain. Seizures, if there is, drug therapy may be done to control the seizures, and in some cases, early surgical removal of part of the brain with the abnormal blood vessels may be considered, and this is called hemispherectomy. If there's vision problems, you'll have the drug therapy. They may be used to treat glaucoma. Eye drops to decrease any pressure. Photodynamic therapy is also used to treat choroidal hemiangiomas that can affect the eye. And visual perceptual deficits, such as hemianopia, can be treated by occupational therapy or vision therapists. Headaches are treated by medications. Developmental delay in learning problems. There's a wide range of treatment options available for children with delay in learning problems associated with Sturge-Weber syndrome. And then hemiparesis or any other motor developmental or delay may be treated by a physical or occupational therapist. And speech therapy may be required, especially after a patient's having hemispherectomy. So, with occupational therapy treatment, some of the main areas that we can focus on is neurodevelopmental treatment and strengthening. So if there's a delay in any type of motor development, gross or fine motor, if there's a lack of independence and self-cares, training in ADL independence, and any type of adaptive equipment that might be needed to be able to do these tasks, if there's any difficulty in feeding and any adaptive equipment that's needed there as well. We'll look at the sensory part of it, so if there's any sensory defensive behaviors, poor self-regulation, difficulty planning new movements, and areas like that, we can focus on more sensory integration. And then the visual perceptual deficits, you assess and treat the areas that they have difficulty with. Here are my references that I got all my information from. This is my video that I'm going to show you. And I hope you enjoyed.
Rachel knew there was something wrong with her newborn son, Aiden. A deep purple birthmark covered his right eye and scalp. The diagnosis, a rare condition called Sturge-Weber syndrome.
When we first thought that he had Sturge-Weber syndrome, it was a very scary thought. When it's over the forehead and the scalp, it's usually associated with brain involvement.
This change in his vascular pattern of his brain causes the brain to be slowly destroyed, and as it does so, it produces seizures.
Littell Children's Hospital at UCLA is one of a handful of medical centers around the country that could offer Aiden a ray of hope. Scans show the extreme damage that Sturge-Weber had caused to the right side of Aiden's brain. When all anti-seizure medication failed, doctors at UCLA conducted a battery of tests and proposed a radical solution. They would remove the diseased half of Aiden's brain.
If the seizures continue, they can begin to affect the brain on the other side. The goal is to stop the seizures so that we can allow the other hemisphere its best possibility to develop. In other words, we want to let him reach his maximal developmental potential by stopping the seizures as early as possible.
When they first told me that, Aiden's chance was to have this surgery and have half of his brain removed, it was very frightening, because it raises all these questions. Well, what's going to happen to him afterwards? How is he going to be? Is it going to change his personality? I mean, is it worth the risk? On the day of surgery, it was such a roller coaster of a day emotionally, just because, you're handing your child off to these professionals who know what they're doing, and you just have to trust that everything is going to go okay. He's my hero. He's been through so much, and he's still so loving and happy. It was just it was the longest day of my life.
Our hopes for Aiden is that we stop the seizures, and then we will watch and see how he does developmentally. I would hope that with his seizures under control that we begin to pick up more developmental milestones. Hopefully see him advance to the point where he's able to walk, talk, interact with everyone in his environment. He won't be normal, but if we can make him as close to normal as we can, that would be our goal. One child at a time.
He should be able to talk, walk, play with other kids, chew. He can't do any of that. He can't dress himself. He pretty much relies on me and others around him to do everything for him. UCLA seemed to be the best choice. I asked a lot of people, and I had even doctors tell me that if they needed their child to have this surgery, that they would want Dr. Mathern to do it at UCLA. And then the very next day, Aiden opened his eyes up, he looked at me, and I started to sing to him, and he smiled at me, and I just thought, oh my God, he's going to be okay. It was just the best feeling.
1 week after surgery, Aiden went home from the hospital. And 4 days later, Aiden went back to school.
I mean, it was just like, this is amazing. This is a miracle. I have the highest hopes that Aiden will benefit from this surgery, in that it will help him to see the world more clearly, be able to function in this world, and enjoy life the best that he can.
I hope you have enjoyed this presentation, and I'll be hearing from you guys this week.